elders are the pillars of society. The National Commission of Senior Citizens advocates and promotes the dignity, security, wellness, and well-being of older persons, creates a supportive and conducive environment for the elderly, and recognizes their contribution to nation building. To know more about the programs and initiatives on advancing the health and well-being of senior citizens, we have with us tonight the OIC-Chairperson of the National Commission of Senior Citizens, Dr. Mary Jean Loreche. Good evening, ma'am, and welcome to our program. Ano pa talaga itong NCSC, ang National Commission of Senior Citizens? Ano po ang mga primary duties, tungkulin po nito?
Heto kasi siya ay ginawa bilang isang batas. In 2019, it created the National Commission on Senior Citizens primarily to take care of the needs of the older persons. So primarily, it's for policy making, for implementation of programs at yung mga batas na naaangkop upang tingnan kung ano yung makakabuti at nararapat para sa mga nakakatanda.
And when we say senior citizens, anong edad po yun?
Sa ngayon, we are 60 and beyond. Pero sa ngayon kasi, kung titingnan mo, ang mga 60 years old, parang hindi 60 years old eh. So, I think the 60 years old is a good number.
Actually, very productive pa rin po mga 60. And
That's
sometimes they're forced to retire, even if they're not ready to retire, and they're able and willing to continue working, hindi po ba?
Maganda yung sinasabing yan. Totoo yan, no? Able, willing, and capable pa.
Ano po ang sakop o jurisdiction ng inyong pong komisyon, ano, na hindi naman sumasaklaw sa, let's say, sa DSWD at iba pang ahensya?
Naiiba talaga siya kasi this National Commission on Senior Citizens is under directly the Office of the President. And kung titingnan natin, ang DSWD ay pangkalahatan mula nang ikaw ay isilang, nasapian ka pa nga lang ng nanay mo eh. Lahat ng social programs and needs ng isang tao ay nakasaklaw sa DSWD. But NCSC is purely for senior citizens.
Are we unique in that way? Are there other, like in other parts of the world, similar agencies like this or similar commissions?
I believe so. But like for example, nung tayo ay pumunta ng Japan upang sumali doon sa World Health Organization Knowledge Exchange, nakita natin na sila very unique din yung kanilang programa for the older persons. And tayo, ang ikinaganda is, sabi nga sa atin ng Japan nung tayo ay pumunta doon, na ang ating pamahalaan ay mahal na mahal nila ang nakakatanda at pinaghahandaan na as early as now. Because for Japan, it took them 40 years to be able to develop their programs, their policies and guidelines for the older persons.
Tayo, kumbaga kung tutuusin, parang bata pa yung ahensyang ito, itong komisyon na ito, no? But it's done quite a bit already.
Yes, and because we're an aging population, Ange,
yes,
yung ating ngayon, we are around 12.5 million Filipinos all over the country who are 60 and beyond. According to the World Health Organization, we are an aging population. Once you reach 7.5% of your total population, you are called an aging population. Nung tayo nga ay nakipagpulong sa Department of Health, sabi nga ng secretary doon ay he doesn't want to wake up na magbulantang tayo na hindi tayo naghanda na tayo pala ay an aging population. Kasi there will be ramifications there that are negative for us. For example, pag hindi natin napaghandaan an aging population, I think that's where the governance trust is. Number one, we will become a burden economically to our government. Pangalawa, magkakaroon tayo ng problem sa ating healthcare.
Yung mga social services.
Yes.
Yung pong pati insurance, ano po?
Kasama yung pag tayo ay na-admit sa hospital, pag tayo ay nakakatanda na, magiging mabigat siya para sa ating PhilHealth financing natin pag hindi natin pinagandaan.
Yes. Dahil ang commission po ay directly under the Office of the President, ano po ang mandato niya sa inyo?
Very, very simple. To be able to ensure that the welfare and benefits of the elderly population is taken care of. Kaya nga tayo, dalawa yung ating main mandate. One is for policy making. So we lobby with our policy makers on mga batas, mga bills that will help, prepare for whatever benefits sa ating mga nakakatanda. Pangalawa is is to fully implement kung anong programa meron ang ating government for them.
Anong paraan po kaya na maaaring makatulong ang mga mas nakatatanda sa nation building? Because like we said earlier, that there are many senior citizens, the junior seniors, I call them the junior seniors kasi bata pa sila, ay marami pang pwedeng gawin. So they can definitely be part of nation building.
Definitely, very big, definitely. That's why in the framework of the National Commission on Senior Citizens, dalawa yan eh. We have the wellness and health benefits. The other one is for nation building. So pag sinabi natin sila for nation building, we really want them to be actively involved. Kaya we develop livelihood opportunities. Isa yan sa ating pinagkakaabalahan. We have to have programs together with TESDA for skills development, with DOLE for funding sources, with the private sector to allow and give the opportunities to the elderly na magkaroon sila ng pangalawang panghanap buhay tapos sila ay magretiro na.
Kumbaga parang bagong career, no?
Yes.
Kahit na nag-retire na sila sa main career nila. Okay, we'll talk more about work and other related topics later on. But aside from TESDA, sino pa po yung mga katuwang ninyo, mga ahensya?
We really work closely with the various agencies. So for livelihood opportunities, of course, we have TESDA. Kasi TESDA is for skills development and training. Kahapon nga kausap natin si Secretary Benitez kung ano ang pwede nating gawing mga programa. Pangalawa, we also talk to DOLE for funding because DOLE has livelihood programs funding for any groups that they will accredit. Like for example, we have this group or association of senior citizens na ang needs assessment natin, ang gusto naman nila ay baking and cooking. So doon tayo pupunta. We talk to the Department of Tourism via Secretary Frasco on tourism-related opportunities. So meron tayong mga tourist destination areas na gusto natin na magkaroon din ng karampatan na opportunity yung mga nakakatanda to be involved in tourism. Like for example, pwede naman sila doon sa ating mga culture heritage sites. Pwede sila doon sa ating tinatawag na soap making industries. Pwede natin sila i-train for bed making, for being receptionists in hotels and resorts, to name a few.
In other countries, I know, like for instance in Japan, silang tumutulong sa mga batang tumawid ng kalye. Yung meron silang parang flag, di ba? Or may mga supermarkets or stores sa Amerika na mga greeters sila. Nandun sila sa labas ng mga tindahan.
That's true. That's true. And that's what we want to develop with our senior citizens. And there are local government units na we are very much proud of because they hire the retired older seniors, no, the senior citizens na maging part ng workforce nila sa LGU. Like I'll mention Iloilo City, si Mayor Trenias. Yung mga nagbabantay doon sa daanan, yung nagta-traffic enforcer, mga older persons yun. I'll give another example. For example, in Ormoc City with Mayor Lucy Torres, yung kaniyang mga retired teachers are reading stories and books to the people, to the young generation, so they would learn to love reading again.
But these are really dependent on the LGU. Ano po, kung ano yung gusto nila sa kanilang nasasakupang lugar. But on a national level, meron po bang efforts to make it more national in scope?
Yes, that is a very good question. Thank you for that. We have one major program now, ang flagship program ng komisyon, ang tinatawag namin community care centers for senior citizens. So it's like a one-stop shop na kumbaga it's a convenience store like where lahat ng pangangailangan ng isang nakakatanda ay doon gagawin. For example, we have what we call social prescribing. Alam mo ba na anxiety, depression, dementia is a reality on the ground.
Yes.
So kung sila ay socially active and interactive, it delays the progression of these diseases.
Right.
So we want them to have time to be marites together, maybe chismisan lang o kaya naman manunood lang sila na mag-TV marathon sila. And then we have what we call the wellness and health programs ng Department of Health that can be put there. So instead na pipila sila sa mga health centers, the services are brought to the center where the seniors congregate and they are given kung ano yung pangangailangan. So that is only to name a few of these programs and we want it on a national level.
And this is this barangay level or is this like citywide? Paano
It has to be at the beginning kasi it is embedded in the Senior Citizen Center Act. May batas kasi na nagsasabi na dapat bawat munisipyo, locality, or LGU magkakaroon ng sentro. But it's not happening all over the country. There are areas na wala talaga. Pero yung meron na, gusto natin maging programmatic ang approach and we want it to be cascaded up to the barangay level. Kasi syempre yung mga nasa barangay barangay, hirap yan silang mamasahe pa pumunta
Yes.
doon sa sentro natin. So we'll start first with maybe municipalities, provincial, city, towns, and then eventually we're going to cascade that at the barangay level.
Yes, kasi dapat ho walkable, no? Yung
Yes.
pwedeng puntahan, kayang lakarin, o isang tricycle lamang, andun na po sila. No? So that's why mas maganda po sana eventually maabangan natin sa barangay level. Bukod pa dyan, ano pa po yung mga implementing programs po ninyo para po sa kapakanan
So,
nila?
pag tinignan mo kasi yung wellness and health, andun din kasi tinatawag natin yung benefits. So, pag sinabi natin benefits, nasa amin na po ngayon yung centenarian, no? Effective January 1, 2025. Meron din naman, kasi dati-rati, hinahawakan yan ng DSWD. And slowly, these are being transitioned to us. Pangalawa ay yung tinatawag natin expanded centenarian cash gift na bago lang naging batas na pinirmahan ni Pangulo nitong February of this year. So that will be effective this January 1, 2025. Ang budget ilalagak na sa NCSC. These are the milestoners, Ancha. These are the 80, 85, 90, and 95 years old. They will receive 10,000 cash gift.
Sige, pag-usapan pa po natin yan. Mukhang nakaka-excite yan para sa ating mga mas nakakatandang mga kababayan sa pagpapatuloy po ng in-person.
Handog ng Alice Reyes Dance Philippines, ang natatanging all-Filipino full-length Christmas ballet. Sa musika ni Ryan Cayabyab at sayaw ni Alice Reyes. Puso ng Pasko. Live simulcast ngayong linggo mula sa Kalayaan Grounds ng Malacanang. Kasabay ang National Parole Making Competition Awarding Ceremony at ang Christmas Tree Lighting Ceremony. Hatid sa inyo ng Presidential Communications Office at ng buong communications group ng pamahalaan. People's Television, Presidential Broadcast Service, Philippine Information Agency, Philippine News Agency, at IBC.
At pag-usapan pa rin po natin ang mga benepisyo para po sa ating mga nakatatandang, mga kababayan, mga senior citizens. Minamahal po nating lahat. Ito nga hong nabanggit ninyo, yung Expanded Centenarian Cash Gift Program. So this is a way of sort of like, every milestone, meron silang matatanggap na cash. Po.
When you reach the age of 80, when you reach the age of 85, and then 90, 95, you get 10,000 pesos.
I'm glad because you know why? There was a time na parang nagrereklamo yung mga nasa 80, 85. Para naman kami, baka hindi na kami umabot ng 100. Kaya maganda, may nabibigay na po sa kanila.
And hindi yan nakadeduct sa ating centenarian. So even if you receive already your 10,000 when you reach the age of 90 and 95, when you reach 100 years old, you receive the 100,000 cash gift.
So at least they will benefit from it. Their families also will benefit from it. Kasi sa mahal ng gamot, talagang kailangan natin ng tulong. Although there is a 20% discount on medicines.
Yes. So meron tayong 20% plus 12% sa VAT natin. So in principle, that's 32% when you're talking about medicines and drugs na kailangan nila. At merong mga bago ngayong nakalagak na additional medicines. May listahan ang Department of Health kung ano-ano yung mga additional medicines na may talagang 20 plus 12% na diskwento natin.
Kasi ako po yung bumibili ng mga gamot sa parents ko. Dati may mga vitamins na kasama or supplements. But later on, hindi nakasali. Parang nababawasan yata yung mga
meron na, may mga changes na ngayon. There are even supplements and vitamins that are included, even milk, no, nakakailanganin nila.
As long as there is a doctor's prescription.
Yes.
Right.
But eventually, there is also a pending bill, no? Natatanggalin na yung ating mga booklets. So, sa ngayon, kailangan pa ang booklets, kailangan pa ang prescription. But eventually, kung tayo ay magkakaroon ng database ng lahat ng mga nakakatanda na ma-access natin doon sa ating mga binibilhan, the merchants, no? I think eventually that even will have to be removed, no? Pero sa ngayon, kailangan lang natin muna yung booklets kasama yung ating mga prescriptions.
Okay. Alright, kanina napag-usapan natin ng mga trabaho. Well, alam natin na may mga trabaho na may age limit, no? You can't. At saka talagang hindi pwedeng mas nakatatanda para certain jobs require younger people. But how do we encourage our older people and even companies to actually hire senior citizens?
Mahalaga yan. Una sa lahat, isa sa ating dapat tingnan ang ating GSIS at yung batas natin sa age limit, no? And even the benefits sa GSIS at SSS. Isa yan sa ating isinusulong na i-revisit yan. Kasi nga naman, pag ikaw ay umabot na ng retirement age mo, wala ka ng benepisyo, di ba? So kung ikaw man ay mabigyan ng opportunity to work by these companies, yung benefits for retirement wala na. Dahil tapos ka na doon sa edad na yun. Una. Pangalawa, we are encouraging the older persons to give back again to their country by being productive. So there has to be that paradigm shift na kumbaga pag nagretiro ka sa bahay na lang, di ba mas malungkot at parang yung iba nga nagde-develop ng depression at anxiety.
At nagde-deteriorate.
At nagde-deteriorate sila ng mabilisan. Pero if they become very active again, it's one way of providing, the necessary opportunities for them to share their expertise kung sa volunteer programs na pupunta. Pero for those who would want to work because they are able, capable, and willing and can be trained for another set of skills according to their needs in that particular area, then opportunities should be given to them. Second, the companies who should be hiring senior citizens, kagaya ng ating mga persons with disability, kapag meron silang 10% na hinahire, they're given tax incentives.
Yes.
That's what we are looking for our older persons.
So you're working on that?
We are working on that.
Yes, parang meron po incentive yung mga companies to hire more senior citizens. Meron bang criteria or meron bang mga hinahanap na qualifications na dapat meron pa rin ang isang senior citizen para makapagtrabaho siya?
Definitely hindi na siya kagaya, that it's like a rat race when you are in your younger years and you're applying for a job. Parang unahan yan It's like a Hunger Games based on your credentials and everything.
Hunger Games.
Oh, Hunger Games ang tawag ko dun Pero pagka older person siguro, hindi siya yung magiging criteria noon. Kundi, una sa lahat, anong skills ang gusto nila? Pangalawa, ano ang pwede sa kanila? For example, if you are going to do, yung mga zip line, mga ganyan para sa mga tourist destinations, hindi naman siguro po pwede doon ang mga nakakatanda, di ba? Pero kung sasabihin mo na bed making, o kaya naman sa resorts at pwede silang mag-entertain ng mga guests, o kaya naman kung yung mga gusto natin magpunas man lang, maglinis ng ating mga hapagkainan o nagsiserve natin, pwede naman siguro yung mga nakakatanda. But then we want them to be trained properly for these job opportunities.
And it has to be dignified.
Dignified.
Dapat meron respeto pa rin. Alam niyo kasi pag meron tayo, we're a very respectful culture, or nation towards our elderly people, and when we see them working, we don't want them to work, ayaw baka mapagod. So baka meron hong ganong klaseng sentimiento pag nagtrabaho na pa yung mas matatanda.
That's one angle that we have to look into. Kasi yung kultura nga natin, na gusto natin alagaan na sila, para bang we want to protect them, and sometimes we overprotect them. But at one end, because of the time, the changes in the time today, wherein, lalo na pagdating sa economics, sa livelihood natin, I think it's time to have that paradigm shift to allow them to work. It gives them dignity and respect. Iba yung natatanggap nila dahil sa pinagpaguran nila.
Yes, actually, it gives them self-worth. Kasi yung iba nagde-deteriorate kasi parang feeling nila hindi na sila mahalaga. Wala na silang silbi sa lipunan. Hindi po ba?
Totoo yan.
Pati pamilya nila parang hindi na sila
napapabayaan na din sila. Yes. So yun, isa sa ating minumove talaga is we have what we call the intergenerational connectivity, wherein we want the older persons to be connected to the young generation because that is part of values formation.
Yes.
We're teaching the young generation na itong mga nakakatanda, humubog sa kanila and we want values again na ma-interconnect natin yung generational gap na yan.
Okay, Okay, kanina nabanggit niyo yung TESDA, ano pa yung mga pwede nating gawin para ma-upgrade din or mabigyan sila ng karagdagang mga skills using what they already have or what they already know?
Alam mo, ang ganda niyan, kasi yung pinag-usapan namin ni Secretary Benitez yesterday, 3 levels pala yan. When you talk about TESDA for skills development, number 1, pag sinabi natin gusto natin livelihood opportunity. Pangalawa, pwede pala to develop modules wherein they are trained also for their hobbies. So, kunyari, kung hobby nila ay crocheting, ang hobby nila is for making mga mats for themselves at yung katuwaan lang nila yon, pwede pala yun i-develop again.
And it could be an income generating
It can be
project?
income generating for them. At the same time, it gives them busy and, keeps their mind very active. Kasi dementia, is really a reality now where there's a projection that by 2030, there will be around 1,500,000 Filipinos with dementia. So we really want to delay that one if that is a reality already happening. Kasi that's part, sometimes it happens, especially when you age already.
And it was probably also caused by the pandemic. Kasi people were not interacting as much, di ba? People were keeping to themselves. So baka may mga nagsimula na doon.
Yes.
no?
So, nung pandemic, we saw the discrepancy wherein talagang kinulong natin yung mga nakakatanda because we were afraid na sila, vulnerable sector, they would be the first ones na maapektuhan nung ating COVID pandemic. But somehow, that might be correct at one point, but medically looking at it. But at one end, we forgot their mental well-being and the social aspect of it.
Yes, okay. So ito namang tulong natin or benepisyo para sa mga indigents, yung po mga mas kapos sa kanila pong mga budget at sa kanilang hanap buhay. Ano po yung social pension na yan?
The social indigency program right now is still with the DSWD. That's the 500 pesos dati. Ngayon ay 1,000 kada buwan.
Yes.
So binibigyan, but there are criteria for how you can avail of that. And the problem there is hindi siya enough for them to buy even their maintenance medications. Yes. So for us to be able to address that, ang ating komisyon conceptualize the programmatic approach in the giving of help to our older persons. Ibig sabihin, yun yung ating community care centers where the programs of the government can be felt on the ground.
So hindi lang siya cash assistance.
Hindi lang.
Talaga.
The programs are more important like the wellness, the health nila, social interactions, livelihood opportunities, training of caregivers, and the home care support. So when they're sick, how their family members would know how to take care of them. Preparations for an end-of-life care. So lahat yan ginagawa at gagawin natin sa ating community care centers.
So it's a parang it's a total approach, hindi lang yung isang aspect of growing old, but even the community around that person. So in the beginning, diba, it says it takes a community to educate a child. Ngayon, it takes a community then to help our elderly in their twilight
We call that the
years.
holistic approach in the needs of an older person.
Ayun, okay. And we will have more for you sa pagbabalik po ng ating programang In Person.
Susunod sa Lakbay Tugon, Presidential Help Desk.
Ayon sa Republic Act 7432 o Senior Citizens Act, dapat mabigyan ng kaukulang tulong ng gobyerno ang mga senior citizen.
Maraming programa ang DSWD na pwedeng mapabilang ang ating mga lolo at lola. Meron tayong centers and institutions. Ito yung residential care facilities.
Papasalamat po ako sa kanila kay Ma'am Susan. Pasalamat nga po ako, tinanggap ako.
Kasama sila Attorney Jeffrey Gallardo at Justine Lagamon. Lakbay Tugon, Presidential Help Desk. Ngayong linggo, alas 7 ng gabi. Dito lang sa PTV.
At kung meron pong social pension, meron ding universal social pension.
That's correct.
What is
Nakaambang yan siya ngayon. It's going to be a law. It's a bill that is already, that passed through the House of Representatives, that is being considered now in the Senate. Meaning to say, kasi yung social indigency program natin, merong 4 na criteria yun which is being handled by DSWD. But we're looking forward, by 2026, mailipat yung programa na yan sa NCSC when we are ready to accept the program. So yun, 4 yun kailangan wala ikaw sustento galing sa pamilya, wala ikaw tinatanggap na pension, ikaw ay may sakit o ikaw ay mahina at ikaw ay mahirap. So yun yung kanila But for the universal social pension, everyone, regardless of status in life, when you're a senior citizen, you get a benefit of the cash gift. Ngayon kasi 1,000 yan kada buwan But this one, the bill itself in the House of Representatives, it will start at a certain amount, like it's going to be 500. So hindi depende siya kung ano yung ma-approve ng Senate, But it's going to be pangkalahatan hanggang sa umabot siya to the point na yung 1,000 na tinatanggap ngayon ng indigency program magiging pareho sa lahat. So it cuts across borders, meaning to say whether you have economic support, whether you're not sick, whether you're not frail, whether you have pension, you will be given that one.
So we're waiting.
Yes.
We're going to wait for that para sa ating mga senior citizens. Okay, kanina nabanggit natin tungkol sa kalusugan because health is really one of the main concerns of those growing old. I mean, for all of us, talagang nagkakasakit tayo, lalo na po pag mas matatanda, mas vulnerable sa mga sakit, and mas matagal gumaling. Ano pa yung mga maaaring gawin ng National Commission?
Well, sa ngayon, we are in close collaboration, of course, with the Department of Health. Kasi pagdating sa health and wellness, sakop nila yun So they should have come up with their programs for the elderly care, And yung mga preventive aspect, there's 2 types of medical One is curative. Ibig sabihin pa ikaw ay na-ospital kasi may sakit ka na. So curative na yon. Pero what we are focusing now is really on the preventive aspect. Na kung ikaw, kahit na kagaya ko ngayon, kahit na senior ako, wala naman akong nararamdaman. So I'm a very healthy senior. So we want to make sure that I will be prevented from developing an illness as my age increases. One, so preventive. Pangalawa, kung may sakit ka na, kasi alam naman natin vulnerable na sila, marami na silang sakit, hypertension, diabetes, arthritis, common yan sa kanila. Yung iba pa may mga cancer, may mga COPD. So we want to prevent the progression of their chronic illnesses. Pangatlo, if they do develop complications, we also want to be able to address that. So how are we going to do that? We develop the preventive care. Kaya yung ating one-stop shop concept using the community care centers, doon natin gagawin ang ating mga advocacies on nutrition, on lifestyle, on the dietary needs nila, exercise, physical, even the mental well-being.
So doon ituturo din yon.
Yes.
Opo, may mga Zumba rin ba?
Meron talaga. Pero heto, very funny. Kasi ang Zumba para sa nakakatanda, hindi dapat fast-paced.
Dapat lang,
kasi
gentle lang.
Kasi mamaya magka-fracture yan. Very, very brittle na yung mga bones nila. So the Zumba should be the low-impact one.
Yes.
And we are collaborating. We are going to collaborate actually with with the doctors who are into the rehab medicine for the older persons to develop modules para sa mga ehersisyo na para sa mga nakakatanda.
So instead of sending individuals to individual homes, di ba? Medyo maraming tao, mahirap. Dito na lang sila sa center.
Yes, they can go there, they can interact with each other. Sabi ko nga, marites time para sa kanila. So they do things together and it's on a scheduled basis. So it's easier for them to really realize and understand that the government really loves them. Kasi yung mga programang yan, ma-access nila doon.
Yes, tsaka yung proper nutrition. Kasi kung minsan, may kinasanayan tayong diet, Ang mahilig ang mga Pinoy sa matataba, yung mga crispy patas. Maaalat at matatamis. So, wala bang resistance na, ito na kailangan natin kainin ngayon. Sabihin nila, nakakalungkot naman yung pagkain na yan.
There are many ways of making that very palatable and delicious for them. Kaya nga tayo nakikipag-collaborate collaborate with the Philippine Nutrition Council, yung ating mga kaibigan dyan sa Nutrition Dietitians Association. So, ang NCSC collaborates with all the necessary agencies that will have an impact on our stakeholders, the seniors. For example, another one we're doing now is on research as well. Kasi dapat evidence-based tayo eh.
Research on what in particular?
We have tie-ups now with the National Institutes for Health and the Institute of Aging. Ibig sabihin, gusto nating malaman ano yung mga pupwede, ano yung mga ginagawa natin na pupwede at hindi. At heto bang ginagawa, like setting up the community care centers, comparing with those without it, heto ba ay mas maganda ang outcome pagdating sa buhay ng isang nakakatanda? O kaya naman, hetong isang LGU na to, napakataas ng kanilang diabetic patients or obesity. Ano kayang meron doon? So, we need the research, the data, so we can address accordingly anong mga programa mas kailangan nila.
That is also fitting to the people who actually live there. No?
Yes.
Yung dun sila talaga tumanda at ayun, nagkapamilya. Okay, ito nga po, iniisip ko, like kunyari, sa Kabanatuan, mahilig sila dun sa mga matatamis na sausages, mga batotay. Marami hong may diabetes.
Sigurado yun.
Di ba? Dun sa lugar na yan. So, pag meron tayong community
Care
centers, maa-address nila yan ng mas magandang paraan.
At saka yung datos na gagawin at ginagawa ng Institute of Aging or any research funding agencies, pag may resulta na sila niyan, ibibigay nila yan sa atin. Ngayon, makikipag-collaborate tayo sa LGU, sa local government units, and then collaborate with the other agencies like DOH, DOST, or kaya yung ating sa Philippine Nutrition Council. We can craft guidelines including ano yung mga dietary or lifestyle changes na dapat gawin natin para ma-improve yung kanilang life there.
And pagdating din po sa mental health, may mga geriatric psychiatrists and psychologists pala na yan talaga yung focus nila. And maganda rin po dapat ituro sa mga nasa bahay yung mga dapat at hindi dapat sabihin. Like for instance, nagiging malilimutin na si Lola. 5 beses na tinanong, kakatanong lang, tinanong ulit, tinanong na, tatanungin ulit, di ba? Parang sa mga taong nasa paligid pwedeng sabihin, tinanong yun na po yan, sinagot ko na yan. Dapat meron din magandang
Napakaganda niyan. Alam mo, nung tayo ay nag-observe sa Japan on how they deal with dementia, alam mo, yung dementia care nila, napakaganda. Yung mga kabataan as young as 5 years old, they are members of the dementia care support. Ibig sabihin, tinuturuan sila na pagpaulit-ulit yung nakakatanda, huwag nilang pagtawanan at huwag nilang pagalitan. We really look into that here. And isa sa ating ginagawa din ng ating komisyon is to reach out to DepEd and to CHED na baka naman magkaroon tayo ng programs yung sa curriculum natin sa ating mga estudyante mula bata hanggang sa sila ay mag-aral, whether it's a medical or a paramedical or non-medical courses, i-integrate natin ang isang the topic on elderly care at ano ang i-expect natin pag tayo ay ganito ang edad natin.
Ano po ang, of course, sino ba magsa-sign off dito? Ang DepEd?
Depende yon. Depende. If it's DepEd pagka sa lower education or sa higher education would be CHED, no? So we are trying to do it step by step and we are already touching base, no? Kasi alam natin na isa sa ating dapat is in the curriculum, lalo na we're an aging population. Everybody should be aware, doon sila patutungo. So ano ang dapat nilang maintindihan? Remember our specialist doctors, the geriatricians, are very few in this country. There's only around 100 of them practicing all over the country, serving
and how many
12
seniors
million.
12 million?
Yeah.
And 100?
And only 100 specialist doctors. So we
a-
want really the trainings to start there. We want to be able to develop programs wherein yung referral system, kailan sila dapat i-refer sa mga specialista na ito.
And what's the best approach, di ba?
Yes.
Kasi some magkakasama ng loob nila na, bakit? May problema ba ako? So, pati yun, dapat tinuturo din
So
po
doon
natin.
sa ating community care centers that we are espousing now, we really want that as part of the conduct of the checkup, including yung ating tinatawag na toolkits for geriatric syndromes. So even the mental wellness, we're developing together with the Department of Health and the World Health Organization and the various medical societies how we will be able to have these modules on training, on advocacies, making people understand what is the mental well-being of an older person, what to watch out for if it's an incoming dementia. Ano kaya ang mga dapat nating bantayan sa kanila? Is it just normal forgetfulness secondary to aging, or is it dementia per se?
Yes. And ano rin yung mga pwede pang gawin, like mga interventions. Sabi po nila, pag naglaro ka raw ng mahjong, hindi ka magkaka-Alzheimer's. May mga ganyan pag-aaral
Alam mo,
ba?
totoo yan, ha? There's science behind that. Kasi your mind is very active. Kaya we really promote them to be actively involved. Kaya nga, alam mo ba yung pagiging marites natin is an edge over other countries for delaying the progression of any cognitive impairments.
So, dapat mas magkukwentuhan tayo.
Yes.
Ayan. More human-to-human interaction. Okay. Gusto ko rin po pag-usapan yung consulta package. Ano nga ba ito? This is, check-up po ba ito? Out of hospital outpatients po? Ang treatment nito?
The Consulta Package is a program of the PhilHealth and the Department of Health. That is part of ano yung ini-espouse nila on preventive aspects. Parang early detection. Para kung may sakit ikaw, maunang malaman natin. Pag chinek up yung dugo mo for blood sugar, malalaman natin if you are a pre-diabetic or you're a diabetic. So, Consulta Package. But for the elderly care Consulta Package, we are promoting now, we are in talks with the PhilHealth to improve yung number of tests na sasakupin noon para masali kung ano talaga yung mga pangangailangan ng nakakatanda. Because it's totally different from the general population.
Yes.
Mas maraming pangangailangan ang nakakatanda.
And hindi ka dapat nako-confine sana.
Yes, this is outpatient.
Yes.
And we want it done actually in our community care centers.
Okay, so kamusta po yung progress dyan?
Sa ngayon, we have 3 community care centers that are up and running. Kasi bago lang naman kami sa NCSC, lalo na ako at yung mga kasamahan ko to develop the program. So we have one that's functional really in Moalboal in the province of Cebu. We had that in May 25 of this year. The second one we opened up with Cabatuan, Iloilo province. And the last one, most recent in October, is in Malaybalay City in the province of Bukidnon. So we're monitoring that and seeing if heto nga ba ay talagang maganda para sa mga nakakatanda or dapat pa naming i-enhance ito.
Sige, aabangan po natin yan.
Yes.
Ang mas marami pa niya, mga community care centers. Okay, at meron pa po tayong ilang bagay na nais pag-usapan, kaya walang bibitiw at magbabalik ang in-person.
Gustong gumamit ng electric vehicle pero problema ang mabagal na charging time? Worry no more! Ang dating ilang oras na pag-charge ng electric vehicles, kaya na raw in just 30 minutes? Paano kaya yun? Sabay-sabay nating alamin, dito lang yan sa Sikat Season 5.
Dr. Jean, by profession, you are a pathologist.
Yes, that's true.
What is that?
Oh, that's laboratory science.
Okay. So looking into the microscope.
Yes, that's correct. So if you want to briefly say it, yung inyong mga dugo, pag ine-examine anything that comes out of your body that is examined in the laboratory, that's me. So
Why did you do that? Why did you get into that?
Oh, I I was, when after immediately finishing my medicine here in UERM, I went to the bundoks and checked ano ba ang need ng mga tao in general. And I saw the need for a pathologist there, knowing na, for example, walang dugo, dengue, nagbe-bleed yung pasyente. So, kailangan malaman ko ano ang pwede namin gawin para yung mga pasyente na nangangailangan ng dugo, paano natin gagawin yon. So, that's one aspect of laboratory science. The other one is, kapag ikaw ay naoperahan, kakailanganin ng serohan, ano yung diagnosis? Ikaw ba ay cancer or hindi? Ano ba ang gagawin sa'yo? Tatanggalin lang ba yung bukol o kaya naman ay talagang tatanggalin yung buong organ? So, that's my practice.
And you've been practicing this until last year? Before you
Until
joined?
I got called to serve here in the commission.
Ayun, okay. At ano naman ang naitutulong nitong background ninyo sa medicine, sa trabaho nyo ngayon?
Napakalaki. Because now, being a medical doctor, and especially coming out from the pandemic, you know that during the pandemic, my practice is on developing the molecular laboratories for testing for COVID-19 and helping set up the subnational blood center of the Department of Health Region 7. So we would be able to give the necessary blood supply for the entire country nung nangangailangan sila nung pandemya. So nung tayo ay natawag upang magsilbi dito, nakita siguro ng ating pamahalaan na ang komisyon walang isang medical doctor na commissioner. And alam naman natin na ang pinaka-common na pangangailangan ng nakakatanda ay medical and wellness nila. So I think that's the reason why I was called. And I would say that I understand what's happening because my practice was not limited to the laboratory but on the public health aspect as a whole.
Yes, because of your practice out in the boondocks also?
Yes.
Ano po ang pangarap ninyo para sa ating mga matatanda? Being the leader, the OIC-Chairperson of the NCSC.
Napakaganda ng tanong mo. Mapapaisip nga naman ako. Ano nga kaya ang aking vision for them? Isa lang po siguro ang vision ko para sa kanila. Na sila, kung ano yung kanilang pangangailangan, ay ating maibigay upang sa last leg ng buhay nila, na ibinigay naman nilang sakripisyo sa ating mga kabataan, ay matumbasan natin yon. Pangalawa ay magkaroon ng dignidad yung pagiging matanda na nila. Pangatlo, ang mga kabataan ay gugustuhin umabot sa ating edad ngayon.
Actually, di po ba, it's a choice eh. It's either you grow old gracefully or you end your life, you say goodbye to this world
Yes.
now. No? And syempre gusto natin magtagal sa mundong ito. And we want them to continue to enjoy life
Yes.
even in their twilight years. Ano po? So paano nyo naipapaabot? Paano na ipapaabot ng komisyon na mahalagang miyembro pa rin sila ng ating lipunan?
Una sa lahat, by providing them the guidance in terms of, yun nga, the policies, the bills are there, but it's really in the implementation of all of these programs. So once we are able to implement this on the ground that is felt by every senior citizen, then they will know that number one, they are valued. Number two, they are respected. Number three, that they are so much cared for, not just by their families and the community, by the government as a whole.
And ito, they will actually feel it because of all the little things
Yes.
that are being done for them. Ang isa pang parang maganda itap natin, yung wisdom.
Yes.
So much wisdom through all the years of their life. How are we able to tap into the wisdom, collective wisdom?
Yung tinatawag nating sila ay magiging pool of resource persons natin in some aspects of the livelihood opportunities. I forgot to mention, I want to share it with everyone. One of our major, isa yun sa aking adhikain ngayon, is the Balik Senior Program. There is such a thing as a Balik Scientist Program
Yes.
of the government.
Yes.
Wherein kung ikaw ay maipadala sa ibang bansa, gagastusan ikaw ng gobyerno upang ikaw ay mag-develop some more, no? So you learn more there and then you come back and share it. But there are actually, like me, for the doctors, yung mga kaklase ko nung araw, na nandun sa ibang bansa. Ngayon, magre-retiro na sila. Babalik na sila ng Pilipinas dahil dito naman yung bayan nila. And we want to tap into the richness of the things that they have learned, the expertise that they have honed there. And if we can tap them to become balik seniors, in the programs where they're given opportunities to develop and train the young generation, including the seniors, the young seniors, Napakagandang programa niyan.
So anong klase po? Anong nakikita ninyo? Parang mga seminar, mga...
No, I see. We've discussed this initially with the National Institutes of Health, with Dr. Eva, the director there, that maybe we can tap them. Like for example, pagbalik nila ng Pilipinas, we can find agencies wherein they can again become consultants. They can really give so much of their wealth of wisdom and share it. So, pwede yun eh. We call that the Balik Senior Program.
And they've seen the best practices, di ba?
Yes, sharing the best practices of their learnings and then develop what we have here. And I think that's going to be impressive.
Okay, kasi maganda nga yung Balik Scientist program. So, Balik Seniors naman. Even if, nawala na sila ng Filipino citizenship, maybe this could be a way for them to regain their Filipino citizenship and become dual citizens.
Yes. Actually, kausap natin ang director, ang CEO ng Philippine Retirement Agents Authority, bago lang, just a few days ago, because they have also programs for retirement villages, no? But this time, it's a retirement village for others, no? Yung mga ibang mga nationalities who would want to retire here in the Philippines kasi they want really to develop that the Philippines is a very good, retirement haven for them. So I was discussing with him how the seniors can also be involved here. The Filipino seniors, not just the Balik seniors, but the seniors per se who are in the country, they can also be part of that, not just the workforce, but even, in the caring of the seniors who are coming from the other countries.
Isang tanong na madalas ko ring naririnig, yung mga kababayan natin na tumanda na, nag-retire, gusto nila actually dito mag-retire, pero they're worried about yung kanilang mga yung mga healthcare, mga insurances nila. Meron po bang arrangement din ginagawa ang ating pamahalaan for them to be able to retire here and still benefit from their mga
actually,
health
isa yan
insurances?
sa ating dapat nakapila na pag-aralan natin how we will be able to inganyo them to come home na hindi sila matatakot kasi nasanay sila na yung healthcare nila doon, yung kanilang mga pension nandoon, and pagdating dito wala sila. So that's one avenue where we can develop again through collaboration with the various agencies that are involved.
Ano pa po ang mga plano ninyo for the senior citizens?
Naku, marami yan. Hindi lang dahil sa mga batas na sinusulong natin. Alam mo, ako being a medical doctor, I really look at developing what we call a home care support program. Ang ibig pong sabihin yan ay ang isang nakakatanda, kung siya ay nasa bahay niya na at may sakit siya, kailangan ma-develop natin yung programs. Paano siya maalagaan sa loob ng pamamahay na hindi na kailangan dalhin sa ospital. Pangalawa, we are also looking into talking with the Department of Health on what we call the convalescent care program, na instead na magtagal ang isang elderly person doon sa ospital pag siya ay may sakit, ay dapat ibaba siya sa isang convalescent care para ma-free up yung bed for another senior who will be needing it. But the care is still continuous. Number 2, there's support from the PhilHealth. Number 3, yung caregivers niya maturuan on rehabilitation. So pag uwi niya ng bahay, ay kaya siyang alagaan. So these are programs that we are putting in the pipeline aside from developing programs on livelihood opportunities.
What about yung mga home for the aged? Yung po mga home for the lolos and lolas na mukhang naabandonan na ng pamilya. Yung iba naman, hindi naman sila nawala ng mga anak, pero parang hindi na lang
we call that the long-term care.
Yes.
So in the continuum in the care of the older person, when you look about long-term care, you might be talking about facilities where they can be placed, or it is a continuum, a spectrum of care for the older person from the time na nag-60 siya and beyond. Ibig sabihin, paano yung kanyang wellness, yung preventive aspect, pag siya ay na-ospital, paano kung siya ay maaalagaan. So that's a long-term care. But when we talk about long-term care facilities, it can again be subdivided further. One, is it going to be nursing care in approach? Ibig sabihin, kailangan niya ng medical care kaya siya nandun sa nursing home kasi walang mag-aalaga sa kanya sa bahay. O kaya naman na-abandon na siya o kaya neglected siya. There's another aspect of it, a residential care facility like where wala siyang mapuntahan. So, kaya palaboy-laboy siya. So, ilalagay natin siya doon. O kaya yung mga kamag-anak naman ay walang oras mag-alaga sa kanila.
Wala ring capability.
Instead, na sila ay pabayaan, ay dalhin sila doon. So, these are part of the programs as we look into how we will be able to have that continuum of care for the older persons.
Okay, and so ano po ngayon ang inyong mensahe para sa ating mga senior citizens at sa mga taong nangangalaga po sa kanila?
Okay, so kami po ay nagpapasalamat kay Ange at sa in-person sa PTV4. Kami po ay nabigyan ng opportunity upang maiparating sa inyong mga bahay-bahay kung ano ang mga programang nakahain at nakahanda para sa inyo mula po sa amin sa National Commission on Senior Citizens. Isa lang po ang masasabi ko, hindi po nagtatapos ang buhay natin at ang halaga natin dahil tayo ay nagretiro. Kundi nagsisimula pa lang po tayo at tulong-tulong kasama po ng ating gobyerno na mahal naman po natin ang ating mga nakakatanda at lahat ng various stakeholders natin na kayo po sisiguruhin namin na ang mga programang para at angkop sa inyo ay amin pong magawa upang ito ay maramdaman ninyo sa bawat isa kung saan man kayo naroroon.
Ayan. Dahil tayo po ay tatanda, pero naway hindi lilipas na nalimutan ng lipunan.
Tama.
Maraming salamat po, Dr. Mary Jean. Pagpapahalaga kina lolo at lola. Yan ang patuloy na ipinatutupad ng National Commission of Senior Citizens sa ilalim ng pamumuno ni Dr. Mary Jean Loreche. Ang maipaabot ang mga benepisyo at programa ng ahensya dahil sila ay yaman ng bansa na dapat pangalagaan. At yan ang tunay na mukha sa likod ng mga balita at mga isyong pinag-uusapan, matapang na humarap at nagpakilala. Ako po si Angelique Lazo at ito ang In Person.